As Singapore battles the spread of COVID-19, the National Environment Agency has warned that dengue infections are on the rise, with over 400 cases reported last week.
And they're expected to rise even further thanks to a switch in what's called a dominant serotype of the virus. Experts believe a resurgence of the dengue-3 serotype is highly likely, and this virus type hasn't been dominant here in the past 30 years.
Well, for more on this, we're speaking to Assistant Professor Ashley St. John from the Emerging Infectious Diseases Programme at Duke-NUS Medical School. Thank you so much, Professor Ashley, for joining us. First up, now, according to the National Environment Agency, the number of dengue cases could rise above the current levels. Do we know what's causing the recent spike, though?
So I think that one of the things that is of concern is the rise in the number of dengue-3 cases. So with dengue, there are 4 serotypes of dengue, and usually if you've been sick with one serotype, your immune system is very good at responding to that during a reinfection and preventing you from getting sick again. But after dengue has been circulating in the population for many years, you have a situation where many people are immune to 1 or 2 serotypes but still susceptible to others. And in this case, dengue-3 hasn't been present in Singapore at very high levels in a very long time. So I think that there's a little bit of a concern that with a susceptible population that has low immunity, what we call herd immunity to the infection, you may see more cases.
Mm-hmm. So talk to us a bit about the types of variants that we're seeing. As you mentioned, the dengue-3 serotype cases, the agency warned that we might see an increase in those. But how many other kinds of variants are there? Why is it worrying?
So I think that there are 4 serotypes of dengue, and I think it's a little bit worrying that we're starting to see more cases. But at the same time, dengue-3 has been present in Singapore. You know, there have been sporadic cases and traveler-associated cases, and even though it hasn't caused a major outbreak in a while, it's difficult to predict outbreaks, and it's possible that it could be brought under control if we you know, stick to the efforts to eliminate the mosquito habitats and identify clusters and things along those lines.
As the country deals with COVID-19, is it possible that a person may be infected with both viruses? So
that's a good question, but I think in my opinion, I think it's unlikely, because right now we still have very few cases of COVID-19, and it's really not present in very substantial amounts. So I think it's pretty unlikely that you would be exposed to both of the viruses. At the same time, they also have very different routes of transmission. So, you know, dengue is, of course, spread by mosquitoes, whereas the COVID-19 virus, as it was recently renamed, is spread more by aerosols and sneezing and touching contaminated surfaces and things along those lines. So you would really need to be exposed by these 2 very different routes in order to get a co-infection. So while I wouldn't want to rule that out, I think it would, at this time, unless the numbers of cases really change and escalate beyond what's expected, I don't think that that's particularly likely from my point of view.
Mm-hmm. What we do know of the COVID-19 virus is that one of the symptoms could be fever. Same thing for dengue. So what's your advice to the public with this threat of COVID-19 and dengue in our midst?
So I would say certainly the best advice is not to panic, as I think has been repeated over and over again by the public health officials, and to follow the guidelines and just be sure you go see the doctor. And there's a good test for dengue, so you can be tested to see if you have dengue, for example, and that can maybe ease some of the concern about whether or not COVID-19 could be the cause of infection. And at the same time, I think Singapore really learned a lot from the SARS outbreak and the continuous exposure to dengue over the past few years, and it's just important to follow the public health guidelines and, you know, be willing to respond as changes occur.
Professor, thank you very much for that insight. We've been speaking there to Assistant Professor Ashley St. John from the Duke-NUS Medical School.